Hi, this is Dr. Jennie Byrne. I'm a psychiatrist here at Cognitive Psychiatry of Chapel Hill, and I'm very happy to present a quick video here with a colleague, Pat Boyle, who is the rep for Alpha-Stim. Pat's been a big help to us with our patients over the years, and I'm going to let him show you a little bit about the product, tell you about it, do kind of a quick little demo with me, and then I'll give you some resources at the end if you want to reach out.
Hi, this is Pat Boyle. I'm with Alpha-Stim here in North Carolina. Alpha-Stim is a product that helps people dealing with anxiety, insomnia, depression, and pain. It's been FDA cleared for 20 years, and that's significant because we've got 115 clinical papers that have been done on it. We've got 32 ongoing papers. And what we use is ear clips to get the microamperage current into the brain. This is Alpha-Stim. It comes in a complete kit. And we have two models. One is called the AID, which treats anxiety, insomnia, and depression. And this is the M that treats anxiety, insomnia, depression, and pain. And we have a couple of additional, we use probes, and we have gel electrodes for treating different parts of the body with pain. And then the ear clips here that we'll show you in a minute are used to get the waveform into the brain. But everything you need comes with it. It comes with the batteries and the conducting fluid, and it's a complete kit. Hi, this is Alpha-Stim, and we're going to demonstrate with Dr. Byrne how we use Alpha-Stim, or how patients would use Alpha-Stim. So if I can get you to remove your earrings, because we're going to attach these to your earlobes.
So people using the device, they would take off jewelry above the neck, or
just earrings.
Just the earrings.
There's no impedance with hearing aids. The contraindications are pregnancy, a pacemaker, or any implantable device that can't be turned off, and a cochlear implant, because it has.
So if I had a cochlear implant, no. If I had a hearing aid, that's okay.
That's okay. That's fine. Yeah, and
okay.
Obviously, and we treat people with headaches and migraines and stuff like that also. And so what happens is then we put the ear clips on the earlobes right here, as close to the head, preferably as possible, on both sides. And then we simply turn the device on, and it would conduct a the waveform, our patented waveform at 0.5 hertz into the brain, and it has a very calming effect on patients.
So when I have this on, what would, say this was the first time I was trying it, what would I expect to experience?
So we start out and ask you how you feel. Most people don't feel anything in the beginning, and then we slowly increase the intensity, and we're looking for, we call it getting on the boat, but it's a little bit of kind of a and it's real subtle. Most patients, I can see it before they tell me, and when they feel that, then we turn it down one notch on the intensity, so that we'd like them to be below that feeling.
Okay.
And then they wear it, depending on what the intensity is, that determines how long. So if it's 2.5, they go 20 minutes. If it's 2, they go 40 minutes. If it's less than 2, they go an hour. And the lower and longer, we're finding from research, is more therapeutic. But those are the times to get a complete dose. 2.5 or 20 minutes, everybody's pressed for time.
Okay.
So people try to get to 2.5. Some people think if it's good at 2.5, it'll be great at 5, and it's not true.
That's not true.
It's
Why?
kind of counterintuitive.
Okay.
Yeah, we've done studies that show diminishing return at all beyond 4. But some people, I work with a lot of veterans, like it at a higher intensity.
Okay.
And then kids, older people, I think a lower intensity sometimes works better. But different people, they kind of, I'll give them the parameters, and then they work with it to determine what's a good setting for them, and then that dictates how long they're going to wear it.
So it sounds like the first time somebody tries it, that they would have help. Like somebody like you would come and show them how to do it, and like help them figure out what settings to use.
That's my responsibility, and I have protocol cards that I give people. They got colored pictures, so it shows step 1, step 2. I leave those with them. I'm available via phone or text.
Oh, you're available later on
to
if they
support
need your
them,
help.
right? I've had people that say, "Hey, can you come back and go over it again?" I'm like, "Sure, happy to." I want people to succeed with it, and when they succeed, it's as fun for me as it is for them. So whatever it takes, you know, I'm happy to do that.
And I know that swimmy feeling, so if I have this on, I have that, does that kind of go the whole time I'm using it, or does it kind of come and go, or? So
it depends on the patient, but usually if we get there and I give the device to them and say it's attached to your body, turn it down. If you're uncomfortable, turn it down. If you feel it and you're not uncomfortable, maybe you can let it ride. So we kind of let the patient control that situation.
Okay.
So that they're comfortable.
Any other like side effects or other things I might experience?
We had it tested on 8,800 patients, and the 2 side effects were 9 people out of 8,800 had slight headaches that were self-limiting and self-correcting. When they took these off, it stopped. And 7 people had slight skin irritation, I think from the conducting solution, which is nothing but saline.
Okay.
Those are the only side effects. So
great.
you can't OD on it, you can't abuse it. People call and often they say, "Can I do it twice a day?" And the answer is yes. Yeah, you can do it twice or 3 times a day. I have patients that do that. Yeah.
And like, let's say I had depression and I wanted to try this for depression. Would I see results like right away, a couple weeks, a couple months? What would I expect?
Good question. So with depression, we say about 4 weeks.
Okay.
Kind of has to, this builds up, it's cumulative, and it builds up, it gets better and better and better the more you use it. It takes 3 or 4 weeks to kind of have a breakthrough with the depression, especially if it's comorbid with anxiety or insomnia or pain or something, then it definitely takes longer.
Okay. And so kind of the same for anxiety, it might take a couple weeks to
It might,
build up.
That's our number 1 indication.
Okay.
And a lot of times we see relief. We've got an endorsement from Dakota Meyer, the Congressional Medal of Honor recipient, who said he noticed it in the first 20 minutes, that his anxiety dropped dramatically. So some people experience that, but some people, it definitely needs 2 or 3 days or sometimes weeks for it to really kick in.
But it can have a little bit of a calming effect.
It does. You will feel calming right away on the first treatment. People feel it, they get calm, and that's why therapists like it, because they're telling me that it makes for more productive counseling sessions because it reduces that anxiety.
So they might even use this during counseling.
Yes, see that often.
Okay.
Yeah, absolutely.
And then if somebody's using it for insomnia, would they expect it to work that night, or would it be again like a couple weeks? Or?
I've seen both. I've seen it when we demoed, I demoed a woman in Fayetteville one day, and she said she was menopausal and she noticed a difference in night sweats and menopause right away. Then I've seen other patients that have gone, sometimes they'll go 2 weeks and say, "Pat, nothing, I haven't seen a change." And I'm like, let's try a different setting, stay with it, this is cumulative. And then sometimes it's been like 19, 20, 21 days, they'll text me and say, "Hey, it happened last night. I slept entirely through the night, didn't get up at all, didn't wake up at all, and I feel great." And so we've seen that too.
Interesting. Okay. And then what if I'm also like doing other kinds of treatment, like if I have medicines or if I'm doing
thank you.
You know, ketamine, or I'm doing therapy. It sounds like therapy, definitely you can use it. How about like with medicine?
With medicine, this technology potentiates the medicine, so it makes it more effective. So it's important that you tell somebody prescribing medicine like ketamine that you're using Alpha-Stim, and what we've seen is oftentimes the dosage can be reduced, and in some cases we've seen people get off the medicine entirely.
Wow. Okay. And I understand that you can't just go buy this in the pharmacy.
Right. It's FDA requires a prescription.
Okay.
So we need a prescription from a doctor or a PA. Actually, chiropractors and nurse practitioners can they can write prescriptions. Licensed clinical social workers can write prescriptions. So it does require a prescription. So yeah, it can't be sold on eBay. It can't be sold on the internet. And
so if I see something online that's not really your product, that's
it might not be. We monitor that and try to tell them to take it down because it requires a prescription.
Okay.
And
what if my doctor, like if I tell them I want to try this, but my doctor's never heard of it and they don't want to write a prescription, what could I do then?
So that happens a lot. 2 things. One is they can tell me and I'll go see their doctor and talk to them about it, make them aware of it, which I often do. The other thing is I keep a running list by geography of people that do prescribe the device. So I can give them a list depending on where they live, somebody that's close proximity that is familiar with it and that does write prescriptions, and they can go see them and get a prescription from them.
And I know we've done that here at the practice where we've had patients whose doctors weren't comfortable or not sure, and so they would come here and do a consultation with us, and we could help them. So
exactly.
Great. Anything else that you think people should know about Alpha-Stim?
It's sold with a money-back guarantee. So if they don't get the results in 30 days that they're expecting, we're happy to refund the money minus a 10% restocking charge because they're going to use all the supplies. But the secret is be consistent, do it every day for the first 6 weeks, and even if we go a little bit beyond the 30 days, we can work with them. But if someone wants to return it, it has happened.
Okay.
Yeah, we'll take the
Great.
device back and give them their money back. And I think it's important that they know that.
Awesome. Well, thank you so much.
Thank you. Appreciate it.
Hi, I hope that was helpful. I tried to ask Pat some of the common questions that people ask me about Alpha-Stim, but there is a lot of information online about Alpha-Stim. There's more videos you can read on the website. And in our resources section, I'm going to give you some helpful links that you can do a little more research. We're not going to talk about the pain use of Alpha-Stim today, but if you have pain, I definitely recommend that you look online at some of those resources so you can learn more about how the device is used for pain. So thank you, everybody.